In our last lecture, we have the prevalence, definition, and etiology of bronchiectasis. And in this lecture, what we are going to have is the pathology and pathogenesis of bronchiectasis. Okay, as previously mentioned, there are numerous conditions associated with the bronchiectasis. However, the underlying cause may be very difficult to identify. Among all these conditions, the most common feature that lead to bronchiectasis is the alteration in the pulmonary defense mechanisms, or inflammation. Regardless of the initiating event, any damage to the airways that could result in the impairment of mucociliary clearance functions could render the airway susceptible to microbial colonization. And on the other hand, the infection leads to the inflammatory response that can in turn progressively damage the normal lung architecture, which could further attenuate the infection. So as a result, the progressive nature of bronchiectasis is thought to result from a continuous vicious circle of inflammation and tissue damage. Regarding the pathology, as you can see from these pictures, pathology of bronchiectasis demonstrated significant small airway wall inflammation and larger airway wall destruction, as well as airway dilation, with loss of elastin, smooth muscles, and cartilage. The abnormal bronchial dilation in bronchiectasis mainly affects the medium-sized bronchi, but often extends to more distal bronchi and bronchioles. The affected bronchi and bronchioles are so prominent as to be visible all the way to the pleural surface. These dilated bronchi are commonly filled with purulent secretions. As we can see from the middle picture, this is a gross pathology of a bronchiectasis patient secondary to a large carcinoma. Although we cannot see the tumor, we can clearly see that the proximal bronchus was completely obstructed. As well, the yellowish discolorization of lung parenchyma reflects the obstructive pneumonia. So according to the different pathologies as we have introduced previously, bronchiectasis can be mainly divided into three types, including the tubular, varicose, and cystic. The first one is called the tubular, that is most commonly seen in clinic. It is characterized by smooth dilation of the bronchi. As you can see, it looks exactly like the tram tracks of the train. The second one is called the varicose. From this picture, you can clearly see that the bronchi are dilated with multiple indentations, which looks like a string of bees, right? The third one is called cystic. The dilated bronchi terminate in blind ending sacs. So it looks like the grape-like puzzles of thin, fragile sacs. So just remember, three main phenotypes of bronchiectasis: tubular, varicose, and cystic. That's all for this lecture. Thank you.